Very good afternoon, and this is one study which is a hospital-based study on GLP-1 receptor agonist, that is oral semaglutide, which we have used in our clinical practice. So ideally, the oral semaglutide, which is available in the India, should be used for once a day therapy, but during the titration process, we have experienced some of the GI side effect, and because of the GI side effect, some of the group of our patient has actually tolerated the therapy in intermittent use. And during titration, we have seen that there is some metabolic as well as the weight loss effect of this oral semaglutide, which is there. And we have some of those subgroup of patient, around 90 odd patient in that particular group, and we are sharing the data with you people. Next slide. So diabetes is rising in India. You all know that we are second largest country in terms of number of diabetes patient in whole world, and about 422 million people worldwide have diabetes, and majority are living in middle income countries. So cost of therapy is a very important aspect once you consider the treatment of diabetes. It requires the treatment and monitoring also. And if you see the amount of money being spent for the monitoring of the patient and for the treatment of diabetes, there is a disproportionate relation. If you see the case in India, here we have large number of patients. Many of them are not affording the therapy, and because of which most of the time we don't have much option for them apart from the sulfonylurea and metformin. There is around 1.5 million deaths and directly attributed to diabetes and its complication. We are working in our hospital to prevent the complication of the diabetes, and we are spending a lot of time to educate our patient about the complication, but still the motivation in terms of prevention of complication is lacking. So with more than 80 million reported cases in India, India can be called as a diabetes capital of world, with little resources available for those number of patients. So most of our healthcare experience in the country is expenses is out of pocket. So people are not covered by the insurance, and if they are covered by the insurance company are not covering the OPD part, outpatient patient day-to-day clinical cost. The cost of therapy is directly affecting the care, and most limiting factor for the patients are actually the cost, not the disease. Next slide, please. Next slide. Next. Yes. So though this oral semaglutide is effective, but it is too costly, and often it will result to poor medicine adherence. And many times we see the patient coming to our OPD and they are saying that, look, doctor, I have controlled most of my symptoms, have gone, I have lost weight, my sugar are behaving in a normal manner, and I hardly have any symptoms, but the cost of therapy is the problem. So please down escalate the therapy if possible, because of the cost constraint. So what we have done we have done a study in which we are using the intermittent dosing of this oral semaglutide in our patients, since oral semaglutide has got longer half-life of around 7 days. So in this subgroup of patients, we are using the therapy, and because of the intermittent therapy, we want to see whether there is any result or not. Actually, it was a finding which came during the drug titration, and we see that this drug is effective. And we want to analyze these data of intermittent drug therapy in one particular cohort so that we can use this information for further research question, and further therapy can be planned, further research can be planned in this area so that we can use the oral semaglutide in this very innovative manner, which is cost effective. Next slide, please. Next. So what our study design was, we were doing an exploratory study to investigate research questionnaires that do not have previously been studied in any study previous in the any part of world. And here we follow up a patient in a 3 or 4 subsequent visit, and there are inclusion criteria, and inclusion criteria for the study are male and female, age from 18 to 75. We have intention to treat arm. We have also taken account those patients who have dropped out during the study because of the GI side effect, and we have taken type 2 diabetes patient with or without obesity and patient with dyslipidemia. We have excluded other comorbid condition like renal involvement, cardiac arrhythmia, infection, diabetic foot, and pregnancy. And we have taken first visit after 1 month and second visit after 2 months. The minimal sample size of the population was approximately 98. The confidence interval was 95. Margin of error is around 10%, and population proportion was 50%. So this is a conservative population size is unlimited. So the controlled were the data which is used in the original oral semaglutide trial. Next slide, please. So what our hypothesis says that there is no difference in HbA1c reduced with the both treatment arm. Means if you use the intermittent therapy or you use the continuous, we have analyzed this hypothesis, and our plan was to give 3 milligram then to 7 milligram once a day, and in second arm we have used 3 milligram twice a week and 7 milligram twice a week. So this was the hypothesis, whether to look at whether this intermittent form of therapy is working or not. Next slide, please. So what we have done that we have hypothesized that this once the BMI effect is there, at least there should be reduction of 2 units of the BMI and at least 2 inches of 2 centimeter reduction in waist circumference is there, then it should be taken as a positive result. Next slide, please. Next slide. So what was the method? The yes, go back. Yes, the study used as a paired t-test for testing the hypothesis, and paired t-tests were used to look for the test, and the confidence interval was 95%. The level of significance is obviously p-value 0.05. The sample size was 99, and we are still in process of enrolling the patient, and we want to enroll approximately 150 odd patient in this intermittent oral semaglutide study, so that our margin of error can be reduced to around 5%. So till now we have enrolled around 99 patient, and we are analyzing this data prematurely to present in this conference. Next slide, please. So what were the result? What we have found that the patient intervention which was proposed, that if there is the reduction of HbA1c more than 1%, then we can see that that in our subgroup of patient there was substantial reduction in HbA1c, even if we are using the intermittent dosing of oral GLP-1 semaglutide, that is oral semaglutide. We all know that oral semaglutide is one drug which can reduce the HbA1c up to tune of 1.5%. But in our study, once we kept the cutoff mark to around 1%, and we have found that there is clinically significant p-value in terms of the HbA1c reduction, and there is rejection of null hypothesis. So what we can conclude from this data that there is approximately 1% of HbA1c reduction even if you are using intermittent oral semaglutide. Next slide, please. Next slide. Go to the next slide, please. Next slide, Emily. Next. Please change slide. Next slide. Hello. Next slide. Next slide, Emily. So likewise, this HbA1c we have also. Next slide, Emily. Please change the slide. Please change the slide from your side. Please change the slide. Yes. So we have also analyzed the result in terms of reduction in BMI, and what we have found that the person who is having BMI more than difference of 2 units, there is substantial reduction, and again there was a significant difference in terms of BMI. And what we have found that this drug, once used in the intermittent fashion, it can also reduce the BMI by a tune of 2 units. So here again the result is significant, and patient has lost weight of BMI more than 2 units. Next slide, please. Result number 3. Yes. So in another research question was whether the use of oral semaglutide was also reducing the waist circumference. So unfortunately, in this part, what we have seen that there is hardly there was a reduction in HbA this waist circumference, but the results were not clinically significant. So what we have seen that intermittent use of these oral semaglutide can reduce the waist circumference, but it is not clinically significant. So if you can sum up the all 3 data, what we can infer from all these 3 results is there is reduction of HbA1c up to a tune of 1%. There is reduction of BMI up to a tune of 2 units, but there is hardly any difference in terms of waist circumference. So that was the finding if you are using the drug in intermittent fashion. Next slide, please. So so this is the main finding, and we all know as the Pioneer 6 data, what it tells us that the oral semaglutide is cardiac safe, but in contrast to other GLP-1 receptor agonist, it has not shown any superiority in terms of cardiovascular protection, be it stroke, MI, or all-cause mortality, that is 3-point MACE. So what we have infer in this study that there is reduction of HbA1c, there is reduction of BMI, but there is hardly any reduction of waist circumference. As we all know that waist circumference is one of the important parameter linking to the cardiovascular mortality and 3-point MACE. Probably this may be the reason why this drug is not showing a substantial effect once it is used in clinical practice intermittently. But since the margin of error is around 10%, there are some limitation with our study that intermittent use, we are using other medicine along with this, so coexistent medicine use can also affect the result. There can be effect of selection bias also, since we are treating the patient and the patient who are having less side effect. These are the subgroup of patient who are going to have less pronounced effect also. So once there is more GI side effect, there is more clinical effect, but these patients are having more pronounced GI side effect. That's why there can be reduction in HbA1c and there can be reduction in BMI, but there is hardly any reduction in waist circumference. Apart from this, we need a longer follow-up data and to check this, and what we have substantiated in our study, that looking at the CGMS data from the 5 patients, we have inferred that there is hardly any blood glucose fluctuation even if the patient is taking the drug intermittently. So we can substantiate this finding with the larger clinical study. But right now what we are finding in our patient, that this subgroup of patient, they have improvement in BMI and they have improvement in HbA1c, but there is hardly any effect in terms of waist circumference. Next slide, please. Next slide. So in future direction, we want to plan, no, go back. So in future, we want to plan a more robust study with the margin of error less than 5%, with the sample size approximately 384, and subgroup analysis can be done whether the male and female are responding better or not, whether the patient who are having high waist circumference are responding better or not. So we can collaborate with our colleagues which are working in different countries to actually have a multi-centric trial in this regard, so that this intermittent use of this therapy, whether it is successful, whether it is not having any effect on waist circumference, and the most important part is whether this drug is going to have substantial effect on 3-point MACE or not. So I am very happy if anybody of you is interested in collaboration and going with a study with oral semaglutide in your cardiac patient, because this is the drug which is very promising in terms of reducing ASCVD risk. So thank you very much. Thanks for your patience hearing. Next. Yes. So I will be happy to answer the question, and I will be happy to collaborate from our colleague working in different part of world. Thank you. It's all from my